So what about booster shots? What about the confusion about booster shots, sir?
All right, that was President Biden dodging yet another question, this time about the booster shots that are now being recommended by his administration. Meanwhile, there's questions whether the science and not the politics is actually driving this mood. Right now, President Biden is pushing ahead to announce the release of coronavirus booster shots. That would be the third shot by September 20th. But according to a new report from Politico, there's a big divide between the FDA and the Biden administration. Two FDA officials have actually resigned over the pressure from the Biden administration to make that deadline. Interesting, isn't it? Because when that kind of stuff came up during the Trump administration, the left cried all sorts of foul. Well, an infectious disease expert who sits on the FDA's vaccine advisory committee said, quote, "It was the administration's booster plan. It wasn't the FDA's booster plan." To weigh in on this report, let's bring in medical doctor and chief medical advisor for the Truth for Health Foundation, Peter McCullough. Peter, thanks for joining us.
Thanks for having me.
All right, Peter, I just referenced this. You know, during the Trump administration, we heard all the time about the White House potentially weighing in and overruling the FDA. This sounds like a very similar scenario.
It's true. The science should really drive what we're seeing in our vaccine program. We're 8 months into it. There's 3 vaccines. There must be some winners and there must be some losers. The CDC and FDA hold the data. Americans know this. There's 3 products. They're not the same. With Pfizer, we have data out of Israel estimating about 39% protection. Out of Mayo Clinic, Purinek and colleagues estimate 42% protection. And a vaccine now that can't last a year is not considered viable. So by those standards, with the Delta variant, which is what we're dealing with now, it looks like the Pfizer vaccine is not viable for boosters.
Well, that's so interesting, Peter. But is the reason the booster shot is necessary is because you're seeing these 2 vaccinations that they're just not effective enough? You mentioned the Pfizer one in particular. What about Moderna? What about Johnson & Johnson?
Well, Pfizer's 30 micrograms of messenger RNA, and the data are already out with the Pfizer booster program in Israel. In a paper that hit the wires today by Levine Teffenbraun from Haifa and Tel Aviv, 11,000 infections in adults. They had 1910 infections in the unvaccinated. The fully vaccinated was 9734 vaccine infections, and now in the boosted individuals, 245 infections. So the booster infections, fully boosterized individuals, the infections are coming. It's because the Pfizer vaccine doesn't cover the Delta variant. And a paper by Venkata Krishnan and all showed that there's antigenic escape. And our CDC director has told us that the Pfizer vaccine, and certainly those vaccinated in general, can carry the Delta variant and pass it to others. Now, Moderna, in the paper by Purinek and colleagues, 100 micrograms per shot. Moderna is holding out at 72% protection.
Interesting. All right, so right now, let's just say that let's do 2 scenarios. One is I've gotten 2 vaccinations, either through Pfizer or Moderna, and I want to know whether to get the third. And the second scenario is I haven't been vaccinated. What's your advice?
I think the CDC and FDA really need to give us a report. We've been waiting 8 months for a report, a data-driven report on vaccine failures. In August 23rd, the CDC put up on their site over 10,000 vaccine failures. So the CDC has fully vaccinated Americans. They received one of these different vaccines. They should differentially tell us who's the winner and loser. So, Sean, you need to be able to pick. There's 3 products. You should be able to pick the one that has the best efficacy.
Let me ask you on mask mandates. We saw this story come out in The Atlantic talking about the downsides of masking young students. It says, quote, "To justify continued masking of school kids with no end date in sight, we have to prove that masks benefit kids and at what ages." And we've seen states and communities that are considering masking policies just to be safe should also recognize that being overly cautious has a cost while the benefits are uncertain. So do the positives outweigh the negatives in masking our children?
It really depends if they have symptoms. We know that the virus is not passed to one another. Children can't pass the virus to each other unless they have symptoms. So what we really need is good policy regarding not letting kids with symptoms, cold-like symptoms, go to school. If kids develop symptoms at school, then they need a mask, and then have parents pick them up and take them home. So it should all be symptom-driven. To just generally put masks on everyone, that's been tried in 12 randomized trials. Public masking doesn't work.
Well, thank you, Peter. We appreciate your insight on all that's happening with the COVID-19 pandemic and, of course, the mask mandates and everything else that we have to deal with in terms of the CDC.
Thank you.